Hi everyone, my name is Ashlyn Varner, and today I'm presenting to you SonoBuddy, where we're saving lives one sound wave at a time. I first want to start on a background about myself. So, my name is Ashlyn Varner, and like I had said, I am the creator of SonoBuddy. I've worked in the medical field for about 8 years, with 6 of those years being in the cardiac specialty and 4 of those years being a cardiac sonographer. So, as a cardiac sonographer, I'm trained to identify all cardiac disease, not only visually, but auditory as well. This skill has taught me to understand the complex mechanism of the heart and the backings of how the whole heart functions. So, about sonography though, it utilizes sound waves to create a visual representation of a structure being examined. This transmission of high frequency sound waves will produce a structural heart sounds as well as the picture. So we can actually hear each valve individually, or if there was a hole inside the heart as well, we're able to pinpoint and physically listen to that noise or that murmur. So, a current problem we're facing today in the medical field is that patients are presenting to medical facilities, whether it be their physician's office or a hospital urgent care. They will express having chest pain, where the provider will listen to their heart for cardiac murmurs with their stethoscope and order an electrocardiogram to diagnose if the patient had a heart attack or has blocked coronary arteries. Unfortunately, neither of those are able to identify structural heart disease. Ideally, auscultation and being able to listen to the patient's heart should hear a murmur for the physician to have an idea, but it is becoming a lost art, and it's lost its accuracy and its credibility to physicians knowing how to auscultate a patient correctly. As far as electrocardiograms go, they're only able to identify the electrical current of the heart walls. They're unable to recognize structural heart disease, so that would include valvular heart disease or cardiac shunts. A normal electrocardiogram can misdiagnose the patient from having cardiac issues, which can cost facilities more money from readmitting patients and performing the same exams on these patients, getting the same results. And this is also costing the patient's life. It's putting the patient's life at stake. When a patient has a severe structural heart disease and it's not being picked up and properly diagnosed, they are at risk for death, unfortunately. So the solution I created to this problem is SonoBuddy. All murmurs are caused by a diseased internal structure of the heart, and they have an associated sound that allows providers and sonographers to identify the cause of the disease and the severity of the disease. So this sparked my interest into creating SonoBuddy. How could we use something that simply listens to the heart and can associate the sound with a diagnosis? SonoBuddy will use ultrasound waves, and it will listen and identify the cardiac structures, opposed to an echocardiogram that will visualize the structure and what is causing the disease. SonoBuddy is just going to initiate and acknowledge that a disease is already happening, and the patient will need a further test to keep evaluating what's happening. So this is a small device that would be placed on the patient's chest for a minimum of as long as 60 seconds to diagnose the heart disease associated with the murmur. Artificial intelligence is going to be used to correlate the murmur and diagnosis for an instant result, so they can get on with treating the patient and further getting them better, opposed to sending them home. My process for the innovation so far is to license and patent the concept idea as it is, and then begin creating a prototype. I will then present my prototype to a mechanical engineer to help create a functional prototype, and this will also include the artificial intelligence. I would then like to take the real prototype in to be patented and on my official design. We're going to be able to test the accuracy of the device by comparing it against an echocardiogram. Like I said, an echocardiogram can diagnose these diseases. They're going to diagnose more of the why, but their accuracy will be just the same as listening to the murmur and identifying which valve is being diseased. This is going to be presented to providers, medical facilities, and then potentially larger medical device manufacturing companies. In terms of leadership, Sonobuddy will require representatives to promote the device to providers, improve the effectiveness in any medical practice or hospital. I believe that providers acknowledging the credibility of Sonobuddy will be able to push this device into facilities by seeing that it actually does work and that they want to use it on their patients for treatment. Once Sonobuddy becomes a part of the cardiodiagnostic workup, there's going to be a need to provide training, which can be done by the Sonobuddy company itself, as well as onboarding for facilities when they hire new patients. It's important that everybody's properly trained and that leaders understand we need good training to get accurate results. Although I currently don't have any evidence on the Sonobuddy's efficiency, I can say that cardiac disease is the #1 cause of death in the United States, and it's also the most common cause of death at 31.5% of all deaths globally. There is a need to diagnose patients sooner with cardiac disease, so we're able to lower these numbers and lower the statistic. Thank you so much for listening to my presentation, and here are my references. Thank you.